Thank you, Mr. Chairman, very much. And I appreciate, Mr. Chairman, the regular order that you've created here so that we can question the Secretary on the State Department budget. I wish that there was regular order to deal with the health care bill. I wish that the Republican leadership was having open hearings, public input, so that this massive health care bill, which is being constructed clandestinely, could be seen not only by the American public, but by every member of the Senate before it's brought out to the Senate floor. It could lead to 23 million Americans losing their health insurance, people losing their opioid coverage for illnesses in their own families, and it's just absolutely wrong. This is the way the Senate should operate. What they're doing with that health care bill is absolutely it's just wrong what they're doing, and we're going to have to continue to elevate that issue. So, Mr. Secretary, I want to follow up on what Senator Gardner said, and this story by that is in the Washington Post today about C4ADS, a company that has put together a report called Risky Business, which tries to find the links between the China government and its companies and the North Korean government, and it has identified key component companies that, if they were targeted, could potentially cripple the networks because they are so intertwined with links right into the United States of America. And it could go a long way towards choking off this global illicit finance system, which the North Koreans have constructed. They're centralized, they're limited, they're vulnerable. I really recommend this report to you, Mr. Secretary. I think that this is where we should be going. There's been a 37% increase year over year in trade between China and North Korea. There's no way they're going to respond to our request that they negotiate on the ballistic missile and nuclear question unless they feel the pain of the noose tightening around their economy. This report today is a blistering, scalding indictment of the lack of true enforcement of the trade between China and North Korea with actual financial benefits that flow to individuals and companies in the United States. So I just strongly recommend that you become very familiar with this, because I think it goes right to the core of what we have to be concerned with. Illicit fentanyl comes in from China, comes in from Mexico. In the United States, last year, unbelievably, 59,000 people died from overdoses. In Massachusetts, 2,000 people died from fentanyl in their system. If that was multiplied out by the whole country, that would be 70,000 Americans who died from fentanyl. The precursor chemicals come from China. They're moved to Mexico. Then the Mexican gangs bring them up into the United States. This, for me, is the real terror on the streets of our country, this opioid epidemic. And given the scope of the tragedy, the Trump administration's proposed 32% cut to the budget of the Bureau of International Narcotics Control and Law Enforcement is absolutely unacceptable. It just shows that instead of prioritizing an issue that goes right to the heart of what people are concerned about, where they want our State Department, where they want our law enforcement to be aimed, and instead we see this dramatic undermining of the effort to stop these lethal drugs. Can you talk about why there would be a 32% cut, Mr. Secretary, given the epidemic of fentanyl coming in from China and Mexico?
Well, Senator, I could not agree more with your assessment of the seriousness of the threat of fentanyl as well as other illicit narcotics. We have underway, as a result of Secretary Kelly and mine's first bilateral visit to Mexico City, one of the issues we had on our discussion early on was this trafficking that occurs either from Mexico or certainly through Mexico. I told my Mexican counterparts it's time to stop playing small ball. We've got to start playing large ball. We have followed that up now with 2 additional bilaterals, one most recently held here in Washington, where we are mapping out a different way of attacking the issue in a supply chain, value chain mechanism. Where are things produced, where are they manufactured, where are they distributed and transported, how are they marketed, how are they delivered. So clearly there's parts of all of that that they own, there's parts of it we own together, and certainly the part that we own is how do we get at why we are the demand center for this. We brought in Health and Human Services to work with us in this effort as well.
Have you raised this issue with your counterpart in the Chinese government?
We have discussed with the Chinese government, yes.
Have you raised it yourself?
In my discussion with the Chinese, I have talked to them about the illicit drug flow coming out of China through Mexico.
Fentanyl specifically?
Yes.
Yeah, and what did they say?
Well, obviously they say, yes, it's a serious problem. Yeah. Yes, they will crack down on that as well. I think it's too early to tell what efforts and whether that's producing anything, but we're going to keep it in our dialogue with the Chinese that we need you to work on your source of supply in this, with this particular additive, this fentanyl additive, which is deadly.
Yeah, a kilo of heroin costs $6,000. It can be sold for $80,000. A kilo of fentanyl costs $6,000. It can be sold for $1.5 million.
This is a big business.
The Chinese and Mexicans are rational economic actors. They're moving in that direction. And unless you get a positive response from the Chinese government and Mexican government, then we have to escalate this up to the very top of the list of issues that our country expects the Trump administration to deal with. Thank you, Mr. Chairman.
Thank you.